Hello, it's Dr. Rhonda Johnson. Today is Sunday, November 13th, 2022, and today I'm talking about ivermectin as an ineffective drug for the treatment of COVID. Now, what is ivermectin? It's a drug that's been approved by the FDA primarily for the treatment of parasitic worm infections, and it's used throughout the world primarily for that. Now, ivermectin is cheap and it's readily available. There are two forms in the United States: the human form, which is prescription only, and the animal form, which is used to treat cows and horses primarily with worm infections. Now, ivermectin has been shown in numerous studies around the world to be ineffective in the treatment of COVID. Yet there are some doctors who continue to advocate and prescribe ivermectin to people with COVID. So today, even though I thought I'd never have to talk about ivermectin again, I'm discussing a report that was published in the October 22nd, 2022 issue of the Journal of the American Medical Association. Now, this report summarizes Active 6, which is a double-blinded, randomized, placebo-controlled platform trial conducted here in the United States during the period of the Delta and Omicron variant predominance. Now, folks, I'm not a researcher, but I can tell you that a double-blinded, randomized, placebo-controlled, multi-center trial, which was conducted over 93 sites in 28 states, is a big deal. Now, according to the researchers, the results showed no difference in recovery among outpatients with mild to moderate COVID-19 who were treated with ivermectin, period. Now, overall, everyone in the trial did fairly well. There were some serious outcomes such as hospitalization, urgent care, or ER visits that occurred in 32 people in the ivermectin group and 28 in the placebo group. Death was rare. Just one death occurred in the trial, and that was in someone who was receiving ivermectin. So the researchers also note a lack of treatment effect was also seen for secondary clinical outcomes, including hospitalization, death, or acute care visits. Now, we all know the political story of ivermectin. It became politicized in year one of the pandemic, and many anti-vaxxers still believe in ivermectin. Now, the Food and Drug Administration, the National Institutes of Health, the American Medical Association, major pharmaceutical societies, all discourage prescribing ivermectin for COVID-19, and many doctors and hospitals will not give it to patients who are seeking treatment. So, again, I expect I'll get a lot of friendly and unfriendly comments by people who support the use of ivermectin. Hopefully, I won't have to discuss this topic again, but in the meantime, I hope that you all will be safe and you will be well, and remember that ivermectin doesn't work. That's my message today. Take care.